The official definition of AIDS is designed to eliminate every case of AIDS that presents an embarrassing non-correlation against HIV.
The official definition of AIDS is 30 previously known all diseases in the presence of antibody against HIV. So if you have Kaposi sarcoma and HIV antibodies, you're an AIDS patient. Without it, you're a Kaposi patient. Pneumonia with HIV antibodies is AIDS. In the absence is pneumonia. Dementia in the absence of HIV antibodies is dementia, and with it, it's AIDS. That's the AIDS definition. There is no HIV-specific disease anywhere. Unlike any other microbe that causes a specific disease, just like an instrument makes a specific sound, HIV doesn't make a specific sound. It is said to cause 30 previously known diseases when it's there, and when it's not there, the original causes of these diseases are responsible for them. That is the official definition of AIDS, not my joke.
Using this official definition, HIV proponents arrive at a near 100% correlation between the virus and AIDS. And remember, the HIV hypothesis is based solely on correlational evidence.
Okay, could I get Dr. Horton to respond? You've been very quiet. You are the North American editor of The Lancet, a prestigious medical journal in its own right. What is your take on all of this?
The phrase AIDS, Dr. Duisberg is absolutely right. AIDS is something that we as physicians and scientists have concocted to suit our own purposes.
HIV is believed to have originated in Africa, where an estimated 14 million have the virus. Because of malnutrition and other health conditions conducive to AIDS, statistics from Africa should be at least 14 times higher than in the U.S. Yet surprisingly, it's quite the opposite. People infected with HIV in the U.S. develop AIDS at a rate 10 to 20 times faster than Africans. Figures from the CDC and the World Health Organization have confirmed this since 1987 through 1995.
So the question is, why would the AIDS epidemic behave so differently in the industrialized world?
Duisberg questions if what is being called AIDS in Africa is really the same epidemic.
But the African epidemic, I think, is a completely different epidemic. It affects men and women alike. In America, AIDS is 90% men, and in Europe, 90% men. That's epidemiologically as different as day and night. 50% compared to 90% is completely different. And in Africa, it's possibly malnutrition, parasitic infection, and poor sanitation. It affects, there are no risk groups. There's not homosexuals or intravenous drug users. It's just poor people without running water, without supermarkets, without doctors.
In 1987, the war on AIDS took another drastic turn for the worse. AZT, a toxic chemotherapy deemed too poisonous for cancer treatment, was approved to treat symptomatic and asymptomatic HIV patients in an attempt to kill the virus that causes AIDS. AZT is a DNA chain terminator, a poison designed to randomly destroy the DNA synthesis of reproducing cells. It was initially developed to treat leukemia victims, but after animal testing, the FDA determined that it was too toxic for use in human beings and banned it. But in 1987, when the AIDS scare hit its height, the FDA was pressured into approving the drug for use for the first time in human beings, even for people who were healthy and showed no sign of AIDS. AZT is highly mutagenic, meaning that it destroys the genes in cells and has been shown to cause cancer in rodents. AZT destroys randomly bone marrow, kidneys, liver, intestines, muscle tissue, the brain, and central nervous system. Peter Duisberg claims AZT actually causes AIDS itself.
AZT, yes, does directly causing AIDS-defining diseases. You know, AIDS is a lot of things, but it doesn't cause Kaposi sarcoma, I think, but it does cause immunodeficiency. It was designed to do that. It was designed to kill human cells. In fact, the manufacturer says that specifically that it can cause AIDS-like diseases. The manufacturer, that is Boris Wellcome, says it is often difficult to distinguish adverse events possibly associated with pseudobudin or pseudobudin administration, which is AZT, from underlying signs of HIV disease. In other words, even they acknowledge, not just Duisberg, that AZT causes AIDS or AIDS-defining diseases.
Despite a warning by FDA toxicology analyst Harvey Chernoff that AZT not be approved, the FDA was pressured by AIDS activist organizations to lift the ban, and hundreds of thousands of people began taking AZT, even though AZT cannot cure AIDS and is only supposed to slow down the progression. AZT is expensive and costs between $8,000 and $12,000 a year, most of which is paid for directly or indirectly by the taxpayer. Burroughs Wellcome, now Glaxo Wellcome, the manufacturer, has generated sales over $1 billion a year with AZT. Because of rules allowed by the FDA, a bottle of AZT that costs about $5 to make can be sold for over $500 as a prescription, and much of this markup is being subsidized by the taxpayer. There's no question that destroying DNA is lucrative, but what good, if any, does AZT really do? Patients who begin taking AZT show an immediate increase in T cells, and because it is assumed that HIV is killing those cells, AZT is assumed to be slowing down the virus that causes AIDS.
When you start on AZT, you're killing off your bone marrow, and the blood system notices a defect in red cells and other blood cells and sends out a signal, overproduce as long as you can. And for a while then, people start producing more than they did prior to the treatment. But as you kill off the sources from where it comes, you very soon bring it down to below where they started from, and ultimately pretty soon to death. So within a year or two, most people on AZT are gone, killed off from the AZT. Some last longer and some last shorter, depending on how sensitive they are to the drug.
Peter Duesberg cites Kimberly Bergalis, the young woman supposedly infected by her dentist with HIV, as actually an AZT victim. Before she was treated with AZT, her only problem was a yeast infection common to many women.
She became sick when she was treated with AZT, and she got all the symptoms that you would predict from AZT. She lost weight, and she became anemic, lost her hair, and couldn't walk, and died on a wheelchair a year later after treatment with AZT.
I did nothing wrong, yet I'm being made to suffer like this. My life has been taken away.
Is this AIDS, or is it AZT poisoning? Approximately 200,000 people are currently being treated with drugs like AZT worldwide, many who are not sick and have no AIDS symptoms at all. Studies have shown that physicians are less likely to question authority than other professionals. As long as the American Medical Association and the U.S. Department of Health back HIV, they'll follow suit. The shocking fact is, if HIV does not cause AIDS and AZT is actually killing their patients, the average doctor will be the last to know. The International AIDS Conference in Berlin announced that AZT was ineffective in preventing AIDS among non-symptomatic HIV positives.
We have over 100,000 studies on HIV and AIDS, and there isn't one, there is not uno, epidemiological study that has shown that a group of, I go as low as 10 or 20 men, homosexuals, heterosexual, doesn't matter, HIV positive, but not using poppers, not using cocaine, not using heroin, and not using AZT, ever gets AIDS. Ever gets Kaposi sarcoma, tuberculosis, dementia, or diarrhea at the age of 25 or 35, where these men die when they take the drugs and have HIV. Why is there no such study? I think the answer is very simple, because HIV doesn't do it. It's the drugs that...
Other top scientists joined Duesberg and Stroman in questioning the HIV hypothesis also. Nobel Prize winners Dr. Walter Gilbert of Harvard and Kary Mullis, who invented the PCR.
Dr. Charles Thomas, a former Harvard professor, organized a consortium of 12 signatories to address the issue. They would in time become the Group for Scientific Reappraisal of the HIV/AIDS hypothesis.
We started out by writing a letter to Nature calling for a reappraisal of the evidence for and against the hypothesis that HIV did in fact do all these things. And there were about 10 or 12 signatories to this letter, and it was rejected, even though many of the signers of the letter were certainly reputable people. We tried Nature magazine, and it was ignored. And then we tried the New England Journal, JAMA, and so forth, and Lancet. In each case, we were rejected. They would not publish this letter. It was only 4 sentences long. It read, "It is widely believed by the general public that a retrovirus called HIV causes a group of diseases called AIDS. Many biomedical scientists now question this hypothesis. We propose a thorough reappraisal of the existing evidence for and against this hypothesis be conducted by a suitable independent group. We further propose that critical epidemiological studies be devised and undertaken. Now, that is certainly hardly a bomb-throwing letter, but nonetheless, they would have none of it.